I don't know if the three of you have experienced this, but 5 years ago, didn't really think about, oh, is that medicine available? Mm-hmm. But interestingly, over the last year plus, you may want a specific medicine and you come to find out the hospital doesn't have anymore. Yeah. And you have to adjust, and maybe it's the medicine you typically use for this particular illness. And all of a sudden, you're scrambling, you're pulling out your pharmacology books and trying to figure out what can I substitute for this. Yeah. And it's a real problem.
Now what?
Well, actually, we have Dr. Hold that thought, because I like where you're headed with this, because I want to answer that question. We have Dr. Mark Siegel, Fox News contributor and author of The Inner Pulse, joining us from New York to talk more about these increasing drug shortages. And Dr. Siegel, Jillian brought up a good question. Now what?
Good to see you. Travis, the problem is these are the kind of drugs you would use in the emergency room. We're not talking about Botox here. I mean, there's 180 drugs short, according to the American Hospital Association. As the setup said, chemotherapy, blood thinners, antibiotics, heart medication, and it's 3 times worse than it was 5 years ago. The reason is because raw materials are in short supply. 80% of the raw materials come from overseas. Most of them are generic, meaning that they don't make a profit. And I think the biggest point of all, and this has not been disclosed before, is that the war theater takes the cream off the top. You know, the blood thinners, the antibiotics, these drugs go over to Iraq and Afghanistan, and a lot of times they stay in warehouses there because we don't know how big the war is going to be or what the need is going to be.
In that particular instance, what kind of options do we have? Because now I'm thinking to myself, should I be stockpiling antivirals?
Julian, I think that that's one solution. I think the government needs to get involved with stockpiling for us, the same as they do for the war theater. I'd like to see some of the raw materials just in case, because what ends up happening, and I'm sure Travis has seen this in the ER, somebody comes in with asthma, they can't breathe, you're looking for a steroid, they're out of the steroid. What do you do then? You start getting on the phone and you end up spending a fortune to get the medication you need, or you can't get it at all. So I think I'd like to see the government get involved with, and how about producing more of these raw materials in the United States? And how about generics making more of a profit for providing these medications?
Well, those are all great ideas.
Yeah. And Jillian, if I could respond to your individual question, I think one of the fears that I have is that individuals will start stockpiling these. All that will do is exacerbate the problem.
All you've done is make me think right now that that's what I need to start doing. I'll be honest. Now I'm like this, note to self, get all my doctor friends to write.
But if we do that, and this happened, Dr. Siegel and everyone else, back when the H1N1 virus first hit, people were stockpiling the antivirals, which meant that people who really needed them might be in short supply. And this is where we need to have, at the government level, stockpiling these so that people who need them can have them. Because if we do it as individuals, we're really hurting our fellow countrymen.
Dr. Siegel?
To Travis's point, if this gets out and people start stockpiling these drugs, then we're really going to have a problem.
Thanks so much for joining us, Dr. Siegel.